Welcome to Roots and Branches of Lehi, the podcast where we get to know the faces, stories, and lives that make up our community. I'm Ryan Harding, and I started this podcast as a way for us all to connect with the people we live alongside. Growing up in a small town, I learned that connections go beyond blood. They're built through shared experiences, friendships, and the moments we celebrate together. Each week, we'll sit down with someone new from Lehi to share their unique story, their passions, and what they love most about living here. So whether you've been here for years or just arrived, join us as we deepen our roots and reach out to our branches one story at a time. Welcome, Jeremy Kraft, the chief of the fire department for Lehi City, right?
Yes, sir. Yep, fire chief.
Yeah, fire chief. Perfect. Great. Glad to have you here. And glad to get to know you a little bit better and get to know your position, get to know what you guys are doing here for Lehi City. And so this will be good to chat with you for a second. So.
Yeah, thanks for inviting me. I'm excited to share our story.
Yeah, good. Well, so let's start with you then, I guess, first. Tell me, you're from here? Where are you from originally?
I actually grew up in Montana.
In Montana, okay.
Yeah, and then the job brought me here, actually. So.
Okay. And how long have you been now here?
Oh, I've been down here since '93.
Okay, so good amount of time.
Yeah, a few years.
Yeah, a few years. Yeah, okay. Awesome. Personal connection, I grew up in North Dakota myself. So,
okay.
Bismarck is, and so we'd go through Montana all the time, coming down here to visit my grandparents in Utah and stuff. But love Montana. It's a very beautiful state. So came down here to Lehi. So that job directly brought you here then, or did you have another job in between? Or tell me.
Well, so the story goes like this.
Yeah.
I grew up in a small town in Montana, and my parents both volunteered for the local ambulance. My dad was search and rescue.
Okay.
My dad was a police officer.
Yeah.
Mechanic police officer.
Sure.
One day when I was 14 years old, he took me on a medical call. It was outside of town.
Yeah.
For a gentleman having a heart attack on what we call Bald Mountain. It's kind of like Mount Timpanogos is.
Yeah.
And really from that day forward, I just wanted to be a paramedic, right? I was with an emergency room nurse up on the mountain, and she told me paramedicine is where I should go.
Yeah.
So after high school, I went to college on some sports scholarship stuff, but ultimately I just wanted to be a paramedic.
Yeah.
And there wasn't really an opportunity in Montana back in the early 90s.
Sure.
So my grandparents lived in Salt Lake, so I came down here to pursue that.
Mm-hmm.
In my pursuit of paramedicine, fire service is a bonus. They go hand in hand.
Okay.
In Utah, and so that's where it all started. That's how it started, on a mountain in Montana.
On a mountain in Montana. I like that.
In the 80s.
Yeah. And then that brought, Well, talk to me about, you mentioned, because you're the fire chief, and so a lot of times people think, fighting fires and stuff like that, which is part of your job. But from what I understand, is it east of the Mississippi and west of the Mississippi? It's a little different, or talk to me about that, I guess.
Yeah, there used to be a hard line like that. So we do what's called fire-based EMS.
Okay.
Right? Actually, 85% of what we do are emergency medical calls.
Yeah.
But on the East Coast, they still have traditional fire departments.
Yeah.
And they don't really do medical. They'll go out on car wrecks to do extrication or stuff like that. But medical is all handled by private ambulances.
Okay.
So, in my opinion, and of course I'm biased, for the taxpayers, this makes much more sense.
Sure.
Right? We play dual roles, and so it takes less staffing to do the medical and the fire.
Yeah.
And we serve the community well.
Because I'm guessing there's not a lot of fires all the time, right? I mean, is that, or what, I guess what percentage, or maybe you already said that, 80, what's percentage of your calls are actual fires?
Actual fires, we're probably 5%.
Okay.
Right? And I'm not talking just house fires. We got dumpster fires, car fires, field fires, those types of things.
Sure.
And the reality is we're the only industry that you're ever going to find that we work just as hard to put ourselves out of business as we do to put out fires.
Sure.
And we do that through building code enforcement and up at the legislature getting better building codes so buildings don't burn, public education on fire safety, right? It wouldn't be fun, but no fires would be awesome.
Yeah. Okay. Well, yeah, that would be nice, right?
Yep.
So, tell me like, kind of a typical day for somebody that works for the fire department. What does that look like?
So for the fire department, for me, they're different.
Yeah, so talk about you first, I guess, and then the fire department.
Okay. I do a lot of meetings every day.
Okay.
So I like to believe I'm a servant leader.
Okay.
So when I get to the office in the morning, I'm an early person, so I'm usually there 30 minutes before I'm supposed to be.
Sure.
Go through, check some emails, and then I do a lot of work legislatively in the state to try to help with retirement and cancer and mental health and all those things. So I try to do a lot of that work early before people get there. And then I start working on, department stuff. budget season, I'm working on budget. We just opened another fire station, so really for the last 3 years, that's what I've been doing, is trying to get this new fire station open. But there's not a typical day.
Okay.
I also currently am the vice president of the Western Fire Chiefs Association.
Oh, wow. Okay.
So I got to fill in some work for them during the day, which is really good, and brought a lot of good programs to Lehi. So.
Good. And then talk to me about, so a typical firefighter, what's their day look like?
Typical firefighter. So we do 48 on, 96 off.
Okay.
So they show up day one. They'll do a pass off with the crew that's leaving. Hey, this is broken. Hey, we noticed this. Or, hey, we've been going out on this patient quite a bit. They've fallen down. Things like that, right?
Okay.
What's important. Then they immediately go out and they start checking off the equipment. They usually spend about an hour to an hour and a half just going through every single tool, every Band-Aid.
Wow.
Right? Make sure the equipment runs and we got everything we need, so when the tones go off, it's there.
Yeah, you're ready.
And then, at least in my department, I'm huge on physical fitness. And so they'll go into PT. They'll go spend an hour to an hour and a half working out. And then that usually takes them to about 10 in the morning. A lot of them at that point will do training. Right? They're already hot and they're sweaty, so they'll go out and they'll pull some hose and do some training, come back in, shower, go to the grocery store on day one, and they go once and they buy all their food for lunch that day, dinner, breakfast the next day, lunch and dinner.
Okay.
And then in the afternoon, usually some EMS training. And usually most of the day is centered around training. At 5 o'clock, it's their time, essentially, if they're not on calls. But we know that a lot of them kind of hang out, just, build that bond that is so necessary to have with the crew. But, and I say all that, but calls can come at any time. You can pop a fire and be out there for 6 hours.
Sure.
And your whole day's shot, right?
Sure.
But that's pretty typical without calls interjected.
Yeah.
So.
And you said a crew, how many are on a crew?
It depends on what type of apparatus are running out of there. So in Lehi, if it's an engine company, meaning a fire engine, though generally we put 3 on the engine and 2 on the ambulance in that house. So that's Station 81, 83, and 84 that we just opened. And then 82 is a truck company. Takes a lot more people. That's the big ladder truck.
Yeah. So
4 on the ladder and 2 on the ambulance. And that's what we call minimum staffing. If we have sick calls and people on vacation, but that's minimum staffing. So.
And so when you get a call, how many calls in a typical day do you? I mean, I'm sure each day is different, but if you were to average it, how many?
Yeah, we're averaging about 15 to 16 right now a day in Lehi.
And when you get a call, that means they leave, right?
Yep.
Okay. They go to check it out.
We drop everything we do.
Yep.
So I'm a very mission-driven person. I like to, everything we do surrounds our mission. Our mission statement is our family serving yours. And at the core of our mission is a 911 service. And so nothing else matters when the tones go off but serving that mission.
Okay. That's awesome. And obviously you have the ambulance, but you also take the fire truck to these things, even though it's not necessarily a fire, I guess, or tell me.
So they're all firefighters, and they're all medically trained.
Okay.
So a lot of people ask this question, so thank you for that. On a medical, why does a fire engine or a fire truck go? Well, it's very simple. 2 people may be able to perform what's necessary medically, but they can't move a patient and continue to perform things that are medically, right? So if we have a patient that's, let's just say grandma fell down on the 2nd story of a home and she's got a hip injury, they can splint her up and they can give meds for pain, but they can't move her out of the house effectively. Can they move her? Yes.
Okay.
But effectively, without doing further harm, it's really difficult. So we always send that engine out so we have extra personnel. Car accident, another really great example. The paramedics will be doing the medical care, or the advanced EMTs, while the engine company can be extricating, right? Put them on a backboard, those types of things.
Okay.
And then on a fire, they come together as a company and they fight fire together as a company. So, and we have 4 stations, so 4 companies on every day in Lehi.
Okay. Talking a little bit more about you, how long have you been fire chief?
So I've been here in Lehi as the fire chief for about 10 and a half years.
Okay. And so tell me your path, I guess, to becoming fire chief. I mean, was that something you always wanted to do? Was that something not even close? Okay. All right. Tell me about that. Yeah.
So I moved from Utah and got myself into, I worked for a private ambulance company for a couple of years, got to paramedic school, and I got hired by Provo Fire.
Okay.
And in the meantime, I was working part-time for South Davis Fire. That's kind of where I got my start. So at Provo, I got hired as a paramedic firefighter. They run very similar to us. And I just loved what I was doing. But I'm kind of a progressive person. I like to learn. And so in the fire service, you have promotional exams. So I had been on the job, I'm going to have to think now, about 7 years in an engineer's position. Our test came open. That's the person that drives the fire apparatus. And I didn't want it, but I wanted to take the test, so I took the test. And I did well enough, they offered me the promotion. And I felt like at that point I really couldn't say no. And plus, for me, I knew I wanted to be an officer someday. It gave me the experience of all the positions below an officer.
Sure.
Anyways, so I digress a little bit. But so I took the job, and for 2 years I drove the fire engine. And we have people that absolutely love the job, and I absolutely hated it. I love driving, but on medicals and stuff, they don't have as much responsibility, and I wanted to be in the action. So after about 2 years, I was like, I either got to go to captain, or I can't go back to paramedic.
Sure.
Not in that department. And so anyways, I took the captain's test and promoted to captain. And honestly, at that point, I was like, okay, this is where I want to be. This is probably where I want to finish my career. I'm out running calls still, doing what I love. I was pretty young for a captain.
Yeah.
And a couple years later, there's some big changes happening in the department. New fire chief, a bunch of the old timers had retired, and there was battalion chiefs the next step openings. And I looked around, and I don't want to sound arrogant by any means, but I didn't really want to work for the people that I thought were going to be at the top of the list.
Sure.
Not because they weren't good people. I just didn't feel like they were progressive.
Okay.
And I wanted to be in a progressive department.
Yeah.
And so I had a conversation with my wife, and she said, well, you're in a predicament, aren't you? I said, I kind of am. She said, well, here's the deal. You either shut up and work for whoever promotes, or you get busy and you promote yourself and you push this department to be progressive.
It's good advice.
So that's what I did.
Yeah.
And then I was a battalion chief for 8 years, I think, almost 8 years. And some things happened in that department, and I just didn't feel like upward mobility was going to happen for a long time. So I had a buddy of mine call me and say, hey, there's a fire chief opening in Lehi. We think you'd be great. You should apply.
Okay.
And so I did, and here I am.
And here you are. Yeah. And does that, battalion chief versus chief of fire, fire chief, is there a lot of difference there then, I guess?
Oh, it's huge.
Huge difference.
Yeah.
Okay. Yeah.
So battalion chief is on shift with personnel.
Okay. So you're in the action still more.
Yep. You're in the action. You're over we have battalion chiefs here when A platoon's on, the A platoon battalion chief is over all 4 stations, but they're still running calls. They still sit down and have meals with the crews. And as the fire chief, I'm more administrative.
Yeah.
I can affect change obviously faster being in charge, but I don't necessarily get to run the calls anymore.
Okay.
So, yeah.
And so you've mentioned progressive and stuff like that. So tell me what, over your tenure, of being fire chief, how, what things are you most proud of that you've, that you've done or changed or tell me about that period of time.
As a fire chief, some of the things I'm super proud of is the growth of the department. We've been able to grow. So when I got to Lehi, we were 2 fire stations. We had 35 full-time people, 35 part-time people, and it was a good department, good morale. They knew how to serve the community well. That wasn't something I had to give them. They already had it. And we're now 4 fire stations, 82 full-time people.
Wow.
And we've, in my opinion, we've kept that culture, and we've kept my mantra when I got there was I didn't want to just be an answer to a 911 call. I want to be a part of the community.
Okay.
And we've been able to keep that.
Okay.
And because the fire service is such decentralized command, if you will, decentralized leadership, it's really difficult to keep that, but we've been able to do that. But some other things that I'm super proud of is the way we progress in paramedicine. We're usually cutting edge. Our ROSC rate, or our survival rate from a cardiac arrest, is one of the highest percentages you'll find in the state.
Wow.
We're super proud of that.
Yeah.
And then recently, something that I've been working on really hard legislatively on a bigger picture is me and 2 of my colleagues started what's called the Utah Firefighter Cancer Initiative.
Oh.
And we got statewide early cancer detection testing for firefighters in Utah.
Oh, that's great.
So we're right in the middle of the process of standing our clinic up to get early tested because our cancer rates are astronomical.
Yeah. Just among firefighters?
Firefighters.
Really?
Yes.
Really? Any idea why that is?
Yeah, buildings burn and the carcinogens are in them, and our bodies are superheated and they're open to, our pores are open and all that stuff comes in. Our turnout gear protects us from heat and from steam, but it's not sealed up, and so all that stuff gets in. And honestly, another thing that we've done over the years is, in the past, it was a badge of honor to have dirty gear.
Sure.
But those carcinogens were in that gear.
Yeah.
Now you won't find dirty gear.
Okay.
Like, if we hit a good fire, they'll take their gear off, they'll put it in a bag, they bring it back. We have special machines that wash that out of there. So we're hoping the number goes down, but
just by being more.
But having said that, the materials we're building, chairs and tables and stuff in our homes, have more carcinogens than ever.
Sure.
So, yeah, it's a problem.
Sure. So. Interesting. So, you mentioned as far as the community goes and stuff like that too, what kind of things do you do to try to, be part of the community, I guess? You mentioned, hey, we really try to be not just a call and stuff like that, but what kind of things do you do to try to
We do a lot of public education.
Okay.
Super inviting to the community. We want to be open. If you look at the fire stations that I've built, they have a lot of windows, so people can see us working, and it's inviting. We're old style where they were kind of closed up. So a lot of public education. We just stood up a team 2 years ago called our SAFE team that goes out and does really big public education stuff.
Yeah.
But more than that, we have this culture of we help when needed, right? If, let's just say, one of my engines is going to the grocery store further around, and they see somebody on the side of the road with a flat tire, they're expected to pull over and change that flat tire, help them, right? At least offer help.
Sure.
And just so many little things like that. When they're at the grocery store, they're expected to interact with the public. We have a program called Sticker in Your Pocket. Wish I could say it was mine, but they had it. But we have little fire department stickers. Yeah. You won't find a firefighter that doesn't have one. So every time they interact with a child, they hand them a firefighter sticker. Yeah. Right? We have a big open house in October where we, in conjunction with Fire Safety Week, where we invite kids over to do firefighter activities. I could go on and on. One of the ones we're super proud of is it's a camp. It's called Call to Courage. Okay. And it's for young ladies 14 to 18 years old. And we bring them in for 2 days. It costs them nothing. And we put them through firefighter paces. We do some really great leadership lectures from really successful females in fire industry and outside of. And we've gotten a firefighter one. This will be our 4th year doing it. So we've gotten one firefighter out of it. But more than anything, if you watch them when they come in on day 1, from when they leave on day 2, they have a spirit of they can do anything. And that's awesome. They do rappelling, we cut cars open, they drag fire hose. Wow. And that's become super popular. It filled up so fast this year. Yeah. I wish we had the capacity to do more, but we're doing 25 to 30 ladies a year. Okay. Young ladies, and so it's just stuff like that, right? It's just, for me, it's super easy. If you care about the community, you find ways to serve them. Yeah. And if somebody wanted to sign up for that, is that just on the city's website or on, where? Yeah, unfortunately, we posted it on our social media and it was filled up in about 2 days. So it's already closed.
It's like, sure.
Yeah, we don't even really have to advertise it.
Yeah, it sounds like it.
Word's out there, and they're watching. And so.
And now, so word of mouth, hey, I did this last year, you should do it. Yeah, I'm sure that's.
Yeah, we have people sign up, want to come 2 years in a row.
Oh, sure. Yeah.
But we give preference to newcomers. So, yeah.
That's great.
We're super active on our social media, doing fire service education and things like that.
And I guess, youth groups, are they able to ever, tour a fire station and stuff like that?
We love people to come in, see the fire station, see what we do, see that we live there, see that we cook there. Yeah, we do a lot of that. We don't do any in December. Okay. It's kind of our cool off. Sure. So October is huge fire safety month. We get a lot of schools and preschools and lots of people coming through. Sure. Kind of wind down in November, but December we don't do any tours. That's kind of our reset time where we can catch up on training and different things that maybe we missed because of calls and things like that.
And is there a busier month? I mean, as far as you said, on average 15 calls a
Yeah, middle of summer is a lot busier. People are outside doing things, a lot more traumatic injuries. Sure. But fires we see more in the winter.
Oh, really?
Yeah, people lighting candles, using space heaters, fireplaces, stuff like that.
Interesting. So what are some of the lesser known responsibilities that, firefighters handle? Obviously, we all think of fires, but, like you said, that's less than 5%, right? So.
Yeah. So once again, medical, we do all medical. We got a ton of training hours we got to keep up on to maintain our certifications, both fire and medical. So training is huge. Sure. when there's water, that's a caveat, but we test and open and operate every single fire hydrant in the city every single year to make sure it's functional. We go and inspect every single business every year as part of their business license. We call it a fire and life safety inspection. And there's a lot of businesses. So, and then, beyond that is just like knowing your area, right? Each station has a district that they're responsible for and then a backup district. And our expectation is that our men and women know that district. So when the tones go off, we do have maps and we have Google now. But if they already have an idea and understand the district and understand what buildings are there, it makes them better, faster, those types of things.
Sure.
So,
and do you ever have to, what about, when there's forest fires or different things like that? Do you guys, do you ever get tapped for, for those kind of things?
Yeah, we do have a national wildfire team, and we send out all over the western United States to help out. When they go, they're 14-day deployment. Well, they're on scene for 14 days. So, like if they're going way out in Oregon or something like that, 2 days to get there, 14 days, and then 2 days home.
Okay.
So,
wow.
Yeah, which has paid off, big for us. When we had the Traverse Fire a few years ago, we saw the fruits of our labor helping other communities, and that we got a lot of help, but we are better for fires like that because of helping outside.
Better how? Or you're saying because you had more training, essentially, you were able to...
more training, experience. We understand that fire behavior better.
Okay.
Yeah,
so
some
you knew what to
techniques
do.
that a lot of cities that if you're not out doing that, we just don't get enough of those in our own city to be proficient. So that's how we gain our experience. Okay.
So in some ways it's a form of training then to go out.
Yeah. And it brings a little money into the city.
Which is good.
Yes.
Yeah. Okay. Yeah. No, that's great. Okay. So as far as families go and stuff like that, what are some, and again, we're focusing on the fire part here, but what are some practical things that people can do to kind of, be more safe in their own homes?
Yeah, they're super simple things, right? Smoke detectors save lives. It's proven over and over again. So make sure you got good batteries. Make sure you got working smoke detectors.
Yeah.
If one's chirping on you and you replace the battery and it's chirping, don't pull the battery or pull it.
Sure.
Get a new one, right?
Yeah.
We see that a lot. Close your bedroom door at night. It sounds so simple, but a simple closed door can buy the fire department 15, 20 minutes to save you versus sleeping with your doors open if there's a fire. We see a lot of places where the utility room in the house becomes a storage area. So you store a lot of things around a furnace and a water heater with an open flame. So don't do that. Okay. Don't store gasoline, stuff like that in your garage. Yeah, those are some super simple things that help you be fire safe. Okay.
As far as residents go, is Lehi City very supportive of fire, the firemen and stuff like that? Anything?
Yeah, community-wise, we have really great. The city does a survey every year on resident satisfaction with departments. Yeah. And I'm proud to say that every single year we've been the top department with the resident satisfaction.
That's great.
So, and generally, honestly, the complaints we get are people just don't understand. And so you listen to them and explain, and probably 90% of the complaints we get, and we don't get a lot, but they're like, oh, okay, that makes sense. And so they just need more explanation, which puts the onus back on us to do more public education so they understand us.
Sure. Yeah. What are some of the complaints, examples, I guess, or,
just like understanding how the ambulance works and billing with the ambulance, or, we get a lot, why is a fire engine going to a medical call, or, things like that. Some people see it as a waste of taxpayer dollars.
Sure.
And yeah, I appreciate those questions, and, the community asking questions causes us to look internally and, make sure we're doing the right things.
Yeah. I guess, with the fire engine and stuff like that, because I guess, you would have to buy another vehicle then, I guess, right? Because you need enough people, I guess, right, to be able to.
Yeah, and they just don't understand that. And the reality is, so we don't get that many fires, we've established that, but if they go out on a medical call, and let's just say we put them in a pickup, because it's a lot cheaper to run one.
Sure.
But then all of a sudden they get a fire, now they got to go clear back to the fire station, change over their gear to the fire engine, and then go.
Yep.
And fire doubles every 45 seconds, the size of a fire, every 45 seconds.
Okay.
So time is huge to us.
Yeah.
And it's one of our measuring sticks. We try to be on scene of every fire and every medical within 4 to 6 minutes of dispatch. So 90% of the time, 4 to 6 minutes is our standard.
Wow. Okay.
And we're pretty good at meeting it.
Yeah.
Right? Time, and same thing on a medical, time is loss, right?
Yeah.
If somebody's having a heart attack, The longer we're not there, the more cardiac muscle that dies.
Yeah.
So we got to get there. And that's why we take the vehicle that is most appropriate to do everything with us everywhere we go.
That makes sense.
To the grocery store. That's a complaint that I've had a lot.
Sure.
Why is a fire engine or the ambulance there? Can't they just go in their own personal vehicle? Well, no, they're on duty. So, and if they're in the middle of the store getting groceries and the tones go off, they walk away from the cart.
Yeah.
And the grocery stores know that we do that, right? They're pretty understanding, but they'll usually keep it for them because they'll come back and finish buying it.
Sure.
But, yeah, we don't finish shopping.
Yeah,
we
because
don't
you go straight to the call. You can't. Because I mean, you talk about going from Macy's to the fire department and then back or something like that. You know, that's
And same thing, the firehouse. You're in the middle of a shower.
Sure.
Shampoo in your hair.
Yeah.
You don't take the time to get the shampoo out of your hair. It's happened. You jump out.
Yeah.
Dry the best you can while you're running to your apparatus, and you go on the call.
Yeah.
Because, as I talked about before, that mission, that core of that mission.
Yeah.
That's what we're here for.
Yeah.
That's what they pay their tax dollars for.
Yeah. I love that. And I appreciate you explaining that. You know, and it sounds like you do a good job with some of those complaints where people, hey, you know, I mean, because we're all, you know, Utah's a more conservative state, you know, hey, we don't want to waste money and stuff, but that's a very good point. That's a very good explanation for why you do what you do. Ultimately, it comes down to saving lives, saving, you know, those kind of things. So that makes sense. So I love that. So any particularly, and obviously maybe in administrative, you don't have this as much anymore, but any memorable events as far as something that stands out to you as saving different things, saving people, you know, any kind of memorable events like that?
I have multiple. I have two calls in particular that I like to speak about. One of them, we pulled a young man. He was about 16 months old out of a bathtub. And quite honestly, for all intents and purposes, he was dead. Mm-hmm. But we went to work and we did our jobs and we got him back. They flew him to we got him to the hospital. They flew him to Primary Children's. The outlook was bleak. But just last year, he graduated high school.
Oh, wow.
So, and at that time I was with Provo Fire and I lived close to the family. I didn't know them, but we lived close. But my wife actually knew his mother.
Oh, wow.
And so it's been really fun to watch him progress through life. No deficits whatsoever.
Wow.
Right? So that was super memorable.
Yeah, you saved a life.
Yes, we saved a life. The other one happened when I was a fire chief. I hadn't been here very long, and I was sitting at my desk. I got a phone call. I can't ever remember the organization, but it's like Make-A-Wish.
Sure.
But they had this young man who had less than 48 hours to live.
Oh, wow.
And they wanted to bring him to the fire station, see it. And all the mascots from around, the Jazz Bear and all of them came with him, and then they were going to the Natural History Museum. And they wanted to bring him to the fire station. And so, of course, I said yes. So they pull him into the bay in a limo, and he's non-ambulatory, and he can't speak. Mm-hmm. And so one of my young firefighters, and I want to give him props, his name's Aaron Fuller, who's a captain now, but really just a good dude. He carried him throughout the station to the ambulance and stuff. And I gave him a hat, a fire hat, and a fire shirt. And when it came time for him to leave, I thought it was important to make an impression on him. Mm-hmm. And so I put him in the front of my engine, and I asked him if he would be my captain for a few minutes and watch over my crew while they went to the Natural History Museum. And he got a big smile on his face as I buckled him in. And that was the day I remembered what true service was all about. Hundreds of medical calls. I flew for Life Flight for a while as a paramedic. Yeah. And nothing brought me more pleasure and made me feel like I served than that call. As you can tell, it still makes me emotional. And he passed away. And, you know, my hope is that he remembered that, you know, we gave him the very best night of his life before that happened. But that's service. And that's what I go back to, just serving on a different level. Yeah. It's not always about the 911 call.
Yeah. Well, I'm sure he did remember it, but it sounds like it also had a huge impact on you. I mean, as far as, the fact that you're still reciting it, you know, years from now. Right?
It was very impactful to me. Yeah. And quite honestly, I don't run calls anymore, but another thing that I get a lot of pleasure out of, and I think they love it, is they do a bowling event over here for kids with special needs, and I get to MC that every year.
Oh, nice.
And it's just so fun to go out there and just do good for the community in that respect, right? And I could still run a 911 call, but I don't think they want me out there anymore. But that's what life is about, is helping others, and not just anybody, you know. I mean, anybody, but those special circumstances where people can't help themselves,
Yeah.
That's what we're built for in the fire service.
Yeah. Love that. Thank you. Lehi City's continuing to grow. What challenges do you see with your department as the city continues to grow? I mean, you said you just opened up a new house, right?
Yep.
Station. More coming? Do you have more in the work? Tell me about as far as just the growth that goes.
Yeah, we need one more station in the southwest part of town. And with the high density housing, I think over time, the call volume is going to really hit some of those houses hard. So we may have to double up on the companies in them.
Okay.
One of our biggest challenges right now is just finding people that want to work in the fire service.
Really?
It's more of a job to some of our younger people, not all of them, but then it was like for a lot of us older people, it was a career. And once we got there, that's the only thing we ever wanted to do.
Yeah.
But that's just not society anymore. It's not their fault. It's not society anymore, right?
Yeah. Yeah.
So that's a big challenge because experience is everything.
Yeah.
Right? We can bring new people in and we can train them. It costs us money. But when you lose a 5, 7, 8-year person because they want to go do something else, that's a lot of experience that the new people don't have.
Yeah.
So that's a challenge. I have great support from city administration, always have. So just keeping up with the growth of this city and where's it going to happen and where are we needed. And, watching technology, lithium-ion battery fires are kicking our butt. And we are working as hard as we can to figure them out. But the little ones are not so bad, but the ones in the cars, we can't put them out. We literally cannot put them out.
Interesting.
So we're trying to figure that out, not just here in Lehi, but across the nation.
I was going to say, this is probably a national problem.
Some of the work we're doing at Western Fire Chiefs, but that's a big deal.
That's interesting with batteries and stuff like that. Yeah, I can see that and that problem is only going to increase. Because I mean, that's the future. However quick that happens, that's to be determined. But that is the future, it seems, right?
And it sounds like in southern or Salt Lake County, they're going to put a warehouse and house whoever knows how many thousands of square feet of those batteries. So we help our neighboring cities, and that if we get one of those going.
Yeah, that'd be that'd be hard to put out. So, you mentioned workers and stuff like that coming on. Do you have a hard time filling positions then, or is there enough demand? Or tell me as far as
we adapted. We've adapted some, right?
Okay.
I think as a leader, you have to adapt to society or you die. As an organization, we adapt to society and die. So we've adapted. Our numbers are back up.
Okay.
So we don't have a hard time finding people.
Okay. And when you say adapted, tell me what you did to adapt.
A couple of things. So when I got here, we're a paramedic service, and a lot of people had fire certs. So we said, well, in order to test for us to get the job, you had to have all your fire certifications, and you had to be advanced EMT or paramedic.
Okay.
Well, our numbers started going down, so we said, okay, we got to train them.
Yeah.
So I went out. So we started doing that, and it was really difficult for our department to do that. So I helped establish a training consortium of the 5 cities in northern Utah County.
Okay.
It's called ALPS.
Yeah.
And so together we try to hire in batches, and then we train them together as 5 cities. It saves us a lot of money.
Yeah.
We get more people in the training.
Yeah.
And then even at that, some of our numbers were down. And so one of the things that's not very popular in my department, but I said, we got to stop testing people on a Monday or a Thursday or a Wednesday because the people we want probably have jobs or they're in school. So we moved our test to a Saturday.
Oh.
And it's a long test. You got to come in, take a written, then you got to do a physical agility and an interview in one day.
Yeah.
So I just said, I think we're eliminating people who, may be great for us. And so we did that, right?
And that helped too.
And our numbers skyrocketed the first time we did that.
Okay, great.
And so that's what it's about, right? It's getting numbers so you can choose the best.
Yeah, yeah.
And we just continue to look at ways like that. Yeah.
Way to think outside. I mean, okay, hey, this isn't working. Let's try this way. That's very great to adapt. I mean, do. To your point, hey, it was a career for you, but it's a job for some. And so I liked your view of adaptation. I mean, that's what you have to do in this world, right?
Yep.
So,
it's true.
Like it or not, you can complain. A lot of people just complain and don't fix it, but you're actually trying to fix it, right?
Try to find a solution.
Yeah, try to find a solution. I love that. No, I love that. So you mentioned the cancer research and stuff like that. Is there any other things, obviously firefighting is emotionally, physically demanding. Anything else you're doing to help with that, maybe mental health or different things like that? I'm sure you, obviously as a paramedic, you're seeing hard things at times. Obviously the 16-month in the bathtub, that would be a hard thing to see. Tell me, how you guys are handling that.
Yeah, this is something that has changed so dramatically in my career, right?
Okay.
When I was a brand new medic, you just didn't have feelings. That's what you were told,
sure,
right?
Sure.
Whether you had them or not, you were told you didn't.
don't have them, sure, yeah.
And we didn't talk about mental health.
Yeah.
And even so much when I got to Lehi just 10 years ago, we didn't really talk about mental health. But we've really tried to just open up and have conversations about mental health. And now you hear the crews talking about hard calls afterwards. We've also brought in an organization called First Watch, and our people have access to that whenever they want it, right? It's a lot of it's online now, right?
Sure.
So they just hop on, make an appointment, and they do that. One of the things that I changed is when they have a difficult call. This never happened when I was younger, and I don't blame anybody because we weren't talking about it, but I immediately go get the crew. Generally, it's a medical call, and I pull them from the hospital. I don't let them clean up their mess or anything like that. It just reminds them. And I pull them off shift for a couple hours and just let them be together, right? And then I let them decide, like, do you want to stay here and work? Do you want to go work out? You know, we'd probably buy them dinner or lunch or something like that. Almost always, some of them will want to go home and hug their families. But most of the time, they want to come back with the people that understand that we're there with them. And then we also engage those mental health professionals that we have to be on the ready right now if one of them needs to speak to them. So,
Love that.
Yeah.
It sounds like you're doing a lot of good in the community, doing a lot of good with all that you're doing and stuff like that. Is there anything that we haven't hit on that you wanted to, talk about?
I want to touch back on the cancer a little bit. It's a big passion of mine. I'll drop the bombshell. I'm fighting cancer myself now.
Okay.
100% attributed to the job.
Sure.
And this is an area where what my message is this. We're doing everything we can to clean our own house. We're doing everything we can to do early testing and get legislative support.
Yeah.
But at some point, we may need the community. And my message is we're always there for you. This may be someplace that we need you to help us.
And so tell me then, on that note, how can we help you in that regard? What would be?
Well, currently, we're on a good path. We got some money legislatively, but you'll probably see some fundraising stuff. I'm not a big proponent on tax increases and things like that to pay for this, but you may see some big fundraiser events, big fireman's balls or something like that, or some of the things that we're talking about doing, and just participate, right? And just watch out for it. A big thing right now for me would be if you would go to our website, utahfirefightercancer.org, and just click on it. Because what I didn't understand until I started doing this, but clicks on our website helps us gain clout, if you will, in the internet world.
Sure.
And then we can monetize that by advertisements on our website. So just go check it out. Click on it once. That would be huge for us.
Okay. Love that. Anything else?
Yeah, I mean, I love being a fire chief. I love serving. Anybody that's listening, we're happy to tell you who we are, what we do at any time. Yeah, I appreciate you coming on and letting us talk about the department that just really near and dear to my heart. And I love the men and women here, and they'll take great care of the community.
Well, we appreciate all you've done and continue to do, and glad we got you from Montana. So thanks for coming down.
Yeah, it's my pleasure.
Thank you for joining us on Roots and Branches of Lehi. I hope today's story helped you feel a little more connected to the people who make up our community. Remember, every person here has a unique story, and together, we're what makes Lehi feel like home. If you know someone who would be a great fit for this podcast, please fill out the form in the show notes so we can reach out and schedule an interview. We'd love to hear from you. A big thank you to our sponsors, the Work Harding Home Mortgage Team and Play Harding Nightly Vacation Rentals, for supporting this show and helping us bring our community closer together. Until next time, keep growing those roots and reaching out to your branches. Take care.